Hi, as you already know, I'm Amy, and I just want to take a few minutes to reiterate and further explain what we already discussed in clinic. First, pain is important and necessary. Pain is our body's alarm system and can be protective. Imagine how dangerous it would be if you did not feel pain of a heart attack or a broken bone. Sometimes, however, pain can be pathologic and unnecessary. I want to make it clear that pain is a perception and not a sensation. Our brains process all the incoming information from our skin, from our eyes, and decide how it's going to represent that information to us. Certain models of pain indicate that it is the perception of the threat that determines the amount of pain we experience, not the tissue damage itself. Just last week, I took my 5-year-old daughter to the pediatrician. A friend of hers had warned her that she was going to have to get shots and that they were going to hurt. She became terrified. To her, this was the most painful threat that she could possibly think of. She spent the entire morning in absolute fear of those shots and screamed through the entire process. Her blood pressure went up, her heart rate skyrocketed, and even her body temperature increased. She told me that the shots were worse than she could have ever imagined. Since we were already at the doctor's office, I decided that I was going to get my flu shot as well. Because I am not afraid of shots and I believe in the value of inoculation, I was not apprehensive about this. And I experienced a feeling of light pressure and little to no pain when I got the shot. How can two people receiving the exact same procedure in the exact same environment from the exact same person have such different perceptions of pain? I am not saying that pain is all your fault. I am saying that it is a combination of several different factors and does not always accurately represent the threat and tissue damage that your body is experiencing. Understanding this may help you change your attitude toward pain and help to manage it. I personally have a strange thing happen. I'm a casual rock climber, and whenever I think about hard rock climbing moves, I get this intense feeling of pain in both my hands. Clearly, since I'm only thinking about rock climbing, there's no actual tissue damage happening in my hands, and yet I feel pain. I'm not entirely sure why this is happening. Perhaps since I'm a physical therapist and violinist who relies on her hands for her livelihood, my brain wants to warn me about the inherent danger of such activities. So what is pain? Pain is a perception that your brain produces in response to your circumstances, sensory input, and previous experiences. Sometimes the system becomes oversensitive and leads to constant perception of pain when no tissue damage is actually occurring. I hope that this helps you understand a little bit more about what pain is. These are concepts that we will continue to visit and discuss. Please let me know if you have any questions or if you want any further resources.